Imagine perfectly ordinary people suddenly convulsing, their bodies contorting into impossible, rigid shapes. Their voices distort, and their entire personalities are seemingly overwritten by a hostile presence. For most of human history, this was the terrifying reality of what people called demotic possession. In this 16th century painting, we see Zuleika, a young woman who suffered a sudden onset of delusions, severe motor agitation, and bizarre physical posturing. Modern neurologists use these historical records and academic research to retroactively diagnose the true cause of these ancient cases. They are identifying a specific brain disease in accounts that are hundreds of years old. Without the ability to look inside the human body at a microscopic level, cultures across the globe reached a conclusion based on what they could see. They attributed these identical, violent symptoms to supernatural interventions. This universal terror persisted for centuries because the underlying biological reality remained undetected. The Vatican still responds to this phenomenon as a modern threat. They recently held highly publicized training courses to prepare priests for performing exorcisms. In one modern clinical case, a 33-year-old woman arrived at a hospital exhibiting bizarre eye rolling, severe bodily contortions, and violently abusive language. Her physical state degraded so rapidly and inexplicably that her own family and the hospital nursing staff became convinced she was possessed by a demon. The actual medical culprit was anti-NMDA receptor encephalitis. This is a catastrophic autoimmune disease where the body's own defense mechanisms turn against the brain. Saving a patient in this condition requires moving past ancient rituals and utilizing the tools of modern pathology. The threat begins at a microscopic level. For unknown reasons, the patient's immune system malfunctions and generates an army of hostile rogue antibodies. In many cases, this biological error is triggered by a hidden tumor, such as an ovarian teratoma. The immune system attempts to fight the tumor, but mistakenly targets the brain instead. These confused antibodies cross the blood-brain barrier and begin a direct assault on the neural networks. They target the NR1 subunit of the brain's NMDA receptors. These receptors are essential for memory and cognitive function, and the antibodies physically block them from receiving signals. This cellular betrayal effectively unplugs the brain's communication network. The patient is left in a state where their own body has been physically hijacked. This MRI scan reveals the damage inside the 33-year-old patient's brain. The white areas indicate swollen, inflamed gray matter in the right temporal lobe, a core component of the limbic system. The inflammation also spreads into the frontal lobes. When these regions short-circuit from the swelling, the patient suffers from severe hallucinations and instant, drastic personality changes. The demonic voices described in historical accounts stem from severe language dysfunction. As the brain loses motor control over the vocal cords, speech collapses into an unrecognizable, distorted sound. The impossible physical contortions are involuntary extrapyramidal signs. These dyskinesias are caused by a motor cortex that is wildly misfiring due to the antibody attack. These violent outward symptoms represent a brain that has caught fire, physically losing its ability to govern its own vessel. Recovery requires a clinical reboot called plasmapheresis. Blood is cycled through a filtration system to physically remove rogue antibody proteins. Then, powerful immunosuppressants stop the production of new antibodies. This allows the neural networks to gradually light back up and resume normal communication. This is author Susanna Callahan. She experienced the full progression of this disease, losing her entire personality to the demon. Today, she serves as proof that these patients can experience an astounding full recovery. Neuroscience now provides microscopic clarity to identify these cellular glitches. We have the clinical protocols to rescue the human mind from its own immune system.